Good morning, Turks and Caicos. Welcome to First Edition. This morning we're going to talk about healthcare and primarily the recent talk around the treatment abroad program. In recent days, the government's proposed amendment to the eligibility requirements of the treatment abroad program, commonly referred to as TAP, has generated significant reaction. There have been questions, there have been concerns, and there have been strong opinions on all sides. This morning, to address the subject along with other healthcare matters, is none other than the man himself, the Minister of Health and Human Services. Honourable Minister, welcome. Thank you for joining us on First Edition.
And thank you for having me. And good morning, Turks and Caicos.
You're definitely in the hot seat this morning.
I can feel it already.
So, Minister, conversations about healthcare are never simple because they're never abstract. They involve people, families, and moments of uncertainty. The treatment abroad program, and let's start there in case we run out of time. The treatment abroad program carries both financial responsibility and human significance. Just before though, in one sentence, how would you describe healthcare in the Turks and Caicos Islands? Is it improving? Is it plateauing, or is it under strain?
That's a very good question, and it really depends on the perspective of how you want to view it. In some elements, it has plateaued. In some elements, there has been significant strain, and there have been a number of areas where we have significantly improved. To speak to it, it's a variation of all of those things. That's why we say healthcare is so complex, because of the different viewpoints of the general public, the healthcare providers, the regulators. Everyone would view healthcare as a very complex but yet necessary tool.
And what specific problem is the amendment to TAP designed to solve? Is it financial strain, abuse of the system, sustainability concerns, or is it something else?
Again, just from the mayor, statements that you made just now, it really is to address all of those areas. I mean, if we're going to be quite honest, the treatment abroad program has grown significantly from a cost standpoint over the last few years. And I would just want to go back to a pre-COVID mindset where we weren't at 61 million where we are now, but the trends, the financial trends were definitely growing. And then we get into a post-COVID position where we would see that during that time, persons, even with their ailments, weren't able to travel. Right. So the backlogs would have occurred. And if I can go a bit further here, it's not to say that we didn't have our challenges. That's me being fair in the overall position of what the treatment abroad program is and what it has evolved and what has now evolved. So when you think about that, the treatment abroad program is a variation of all of those things that you would have stated. We do have to address the financial component, which are right here as we speak, as we enter a new financial year. The sustainability, the accessibility. How do we properly manage all of these things? And again, persons want to take on the position of, infringing on rights and privileges and who should have and who shouldn't have. And in no way, shape, or form are we as a government trying to, discriminate in any way, but we do have a responsibility, a responsibility that allows us or puts us in a position to make very difficult decisions that the populace would not understand or have an appreciation for at this time, but we are doing so with all of the necessary legal framework and guidance to make sure that we are still in a position going forward to provide the best primary health care to the citizens of this country as we possibly can through our primary health care components and through the private medical facilities that are offered here throughout these islands.
I'm glad you touched on the subject of discrimination because there have been a number of articles, some of which have even hinted at that. So is it, Honourable Minister, that this amendment withstands constitutional scrutiny in terms of non-discrimination?
To my understanding and from what I've read over the last few days, yes, it will withstand it, and understanding that we are not taking away healthcare privileges, and I think that's necessary to say, because if you listen to the different tones or connotations out there, it would come off as if we just abolishing healthcare across the board. That's not what we're doing. It's about how do we have a greater appreciation, understanding of what your contribution qualifies you for, separate and apart from what the government is funding. They're two different. These are two different spaces. But again, how the general public, and I think this is where, as a country, as a government, we can do a better job at how we communicate with the private sector partners or stakeholders. There's definitely obligation on them to communicate so that persons understand what their benefits are, what their rights are, and where the government is able to step in and add the additional coverage. But again, it comes with making hard decisions.
So let me ask this, Honorable Minister, for the benefit of our listeners and viewers in simple terms. As a born Turks and Caicos Islander, as a citizen of the Turks and Caicos Islands, what are my fundamental rights to health? And give us an example.
So as it stands right now, anyone who goes into a private or a government clinic will be offered services free of charge. Anyone who goes into the hospital would pay a nominal $10 fee, right? Anyone that would go to a private facility would pay whatever the prescribed fee is, but at a discounted rate. When you think about medicines, persons would pay a nominal fee of what those prescriptions would cost. Those are the things, and again, just to go a step further, when you think about the CAT scans, the X-rays, and all of those other services that are offered, all of them are offered at nominal fees. So these are the things that are by right covered and accessible to the wider populace as we provide that level of health care to our citizens. So it's not, and I want to frame my words properly, because I know there's some persons waiting for me to say the wrong thing. We have a duty of care, right? And we have to be responsible. The responsible thing is to provide healthcare services to our citizens, which we are doing. The level of healthcare that we're able to provide at this time may vary, but it's no way, shape, or form us peeling back or taking away anything that you are rightfully eligible for.
And off camera some time ago, you gave me an example of the sort of constitutional right, and you made an analogy of education.
So
draw that scenario for us.
So in the Constitution, it speaks to the fundamental right, and when you think about the social component, it speaks to healthcare in the broader scope. And if you use the same analogy as it would speak to the access to education, by right or through the UN agreements, we are supposed to provide education to school-age kids up to primary level. As a country, we've been doing or going above and beyond, where we've been providing secondary education as well as tertiary education to a wide number of different persons, some free, some at discounted rates. So when you think about healthcare, you think about it in that same scope, whereas the primary healthcare component, which we are currently modernizing and enhancing right now, so that persons can have a greater access, and there will be additional or a wider range of services provided, so that the conversation around treatment abroad or overseas medical care is one of the past, because we would have built such a great capacity locally that there would be no need to send persons abroad. So that is where we are going, and I think if persons would allow us, as the legislators and the government, without all of the misinformation put out there, to give us an opportunity to articulate, yes, some things happen, and we, the state of the state address, if I can just pivot for a minute, I think was a wonderful opportunity, and I think the Premier did an excellent job as to how he articulated what is currently happening in our country and what the future looks like. He made his statement, and we stand behind the statement. It's my job now as the minister responsible to come with and to further pass on the communication necessary, because we do know persons were a bit, they were taken aback. And in saying that, and not straying too far from the previous question, everything still remains the same as it is. So there hasn't been any stops to any of the services. Persons who are currently trained in with certain facilities, all of those things will still continue as scheduled. So there needs to be no fear, because there's still a lot of legislative work to be done, and based on some of the legal scope, it may take a little longer just because of this is a very busy time for the government. We're in our budget prep time, so there are a lot of moving parts. But going back to the initial question, when you think about rights, there are rights that, as a growing country, we know better. We know what we have to do. But you have to allow us to exercise and to show and to prove, right? And not everything that happens from a government standpoint needs to take on such a negative connotation. It may cause us to understand that, times are changing, and government is not in a position financially to do what it once did, but it doesn't mean that we're going to renege on our responsibility.
Listeners, viewers, call a friend, tell a friend that the Minister of Health is on, telling us all about the Treatment Abroad program. Honorable Knowles, why the change in regulation now?
When you think about $61 million or $62 million, I want you to think about where this money is going, who this money is impacting, and what that money could have done for Turks and Caicos, right? It's no secret everybody goes to Cayman, right? But can we look at what has evolved in Cayman over the last few years, right? Everybody goes to Jamaica. Can we look at their facilities and see? Now, one may not have anything to do with the other, but we're all sensible people. The kind of money that we have been pumping into other economies around the Caribbean is quite evident when we look at the facilities that they've been able to enhance, right? When we think about that 62 million, I think about the infrastructure in Providenciales. I think about scholarships. I think about social programs. I think about what we can do more from a domestic standpoint with the amount of money that we have expended. Do we need to take a deeper look at ourselves as a population and our own healthcare? Yes, because if we are a sickly people, that means our level of primary healthcare has not been as accessible as it needs to be, which is where the preventative healthcare component comes into play. We knock the Blue Hills Clinic, but we're doing something about it. We've recently made a purchase of the family care facility, which will be the country's first polyclinic, which will have a wide range of amenities or services that will help us to enhance the service offering. We have to build capacity in South Caicos. We have to build capacity in Grand Turk. When you think about $62 million, that $62 million can go a long way when we think about the primary healthcare component, which would ultimately curve us even needing a treatment abroad program, because we'll have a healthier society for it. That would also help us to have greater dialogue with our local service providers from the private sector side. Gone are the days where the private doctors waited on government. A lot of them are bringing in their own specialists. So we might even find ourselves referring persons to them, so that the treatment abroad program is not as necessary as it once was. So all of these things are being considered. So we can't just we can't just become so negative all the time when things don't go our way. Change is constant. Many of us don't like change.
Yeah.
But sometimes the change is for the right reason. It might not be right in the front of us, but who's to say in the next 6 to 9 months what that would look like? When we can come back to the country and report that we've been able to save X amount of millions of dollars, and then we can expend these monies into other areas of our society. We have an aging population. We have a demographic of young people who are seeking recreation opportunities, who are seeking different career paths, and everybody wants the government to pay for it.
Yeah.
But we can't pay for it if we don't have the money,
Yeah.
right?
When you mentioned that $62 million, Minister, I was envisioning Golden Gate bridges, all over the place. So yeah, it is important, and that can go far. But is the TAP financially sustainable in its current format, would you say?
No, it's not. And again, this is where I have to now, I'll just paint this picture that it's perceived by the general public that the treatment abroad, or what is your contribution to the NHIP, pays for the treatment abroad. That is not the case. The treatment abroad program merely sits within the organization, but it is yet a separate entity, right? There have been discussions of us separating them so there's just two different organizations, because the contribution that we make every month takes care of our primary health care services.
Domestically.
The treatment abroad program comes about based on the referrals that come from the hospital, based on the medical needs that have to be met from an emergency standpoint. And this is where I go back to the local capacity being built, because if the referrals coming based on that client case can be referred to a practitioner locally based on the various skill sets that we are enhancing, then there'll be no need for the amount of overseas medical treatment that we're currently experiencing. So the argument of what I should stop paying my NHIP, if you stop paying your NHIP, you simply wouldn't have coverage. So that means that when you go to the hospital, you'll actually have to pay the real price, right?
That $10 becomes $250 now.
That $10 becomes $250. That $15 medication becomes $150. So what we've been doing is subsidizing so much that persons don't understand what the real cost of medical care is within our country. So it's not an easy conversation, and I say that from a place where I understand the frustration, but you're elected not just for the good times, you're elected for the hard times, right? While I don't consider this a hard time, I consider this a transition period where we have to change the way we think about how healthcare is administered within our country. I mean, we see what's happening in America. We see what's happening in the region. All of those things have knock-on effects, because when we would have once been able to tap into certain markets, we can't do that anymore. We might have to expend more for certain services, and we're not a taxed country. We're not at that pace. But if we were to continue at this current trend of the way things are being done, that $62 million that was mentioned by the Premier could easily shoot into $100 million. And when you start, and again, our budget from a healthcare standpoint is about 24% of the annual budget, which is kind of absurd. That's not normal. So we have to be a bit more financially prudent. Yes, there are going to be a number of persons who would have a wide array of different options. Opinions, as to what they believe should be the order of the day. And we're not shying away from it either, right? But this is where we are as a country. We have to be honest with ourselves. This government, or all governments, have done what they had to do to make sure that our citizens were afforded care at every level. And I just want to say this one thing, right? When persons go away to get their medical treatment and they come back, how many of them come back with a bill? You know, I get a report every Monday, that gives me an idea of what we're spending on the treatment abroad processes. No names, just numbers and locations. And I'm shocked every time, because it just speaks to what we're doing from a duty of care standpoint. We are taking care of our citizens, right? But now we have to change the game up a little bit.
Yeah.
You know, and I think that's where the unsettling feeling comes from. You know, NHIP was never intended to supplement your health care. So nothing, there was never, we never stopped you from seeking medical care through another through another insurance institution. That's not what we intend. That's not what it was intended for. Persons also have to see if that were the route to take. It gives you a greater service offering, you know, for group insurances. From those persons who are working with TCIG, you know, we have to look at how do we now take care of those persons who are currently employed by TCIG, you know, the expat workers. So all of these things are currently in train. You know, we're not going to rush through it just to prove a point, but we are going to make sure that when all is said and done, and when the ink dries, everyone who is eligible, and I have to say eligible, because we know where that conversation can lead to, everyone who is eligible will receive, or will be able to access all of the services domestically that they are rightfully obliged to have.
So, Minister, with the projected savings in TAP eventually, is it fair to say that your ministry will have more specialist services here at the hospitals, oncology, cardiology? Is it fair that those savings will provide some specialist services then in Ireland?
So we're looking to enhance all of the service offerings, and you know, we do have a meeting with the private and government doctors on the 10th of March, where we will have a greater in-depth dialogue around, you know, everything currently transpiring in the medical field. Yes, we have to enhance the service offering. We need to create our own centers of excellence here, and that's something where the private sector can lead on, because when you think about, you know, the cardiology, the ophthalmology, the oncology, the neurology, you know, all of these different specialty areas that are greatly impacting Turks and Caicos, why not allow them to tap into those areas? But by doing so, it provides greater capacity. They may need to bring in more specialists. Government could allow greater access to work permits. If we can save from expending all of these monies, and they may need to now expand their resources, they may be able to tap in to whatever government availability there is for them, you know, without having to go to a financial institution. So we have to look at the pros and the cons. You know, we're not just moving one feature away from the greater scale of things. You know, we have to, not that we want to, we have to build capacity locally. You know, it's just evident. You know.
Yeah. From your reports and stats, Honorable Minister, do you know the number of non-BOTC individuals that access TAP over the last few years?
We do have the stats on it, but I don't have those stats with me. But I do know that it is, the number definitely exceeds that of Turks and Caicos Islanders or persons of TCI status.
Okay, because I just had a question from a viewer who wanted to know if you knew the number of work permit holders versus the number of non-work permit holders who
No, that
access
information
the system.
I'm probably on a subsequent.
You mentioned the clinics. Let's talk a little bit about the clinics. What's happening in Blue Hills? And there's talk about a polyclinic. Tell us a little bit about those.
So we do know that the Blue Hills Clinic is, while it is very historical, it served its time. It's been plagued with a number of structural impediments, and we made a decision to demolish the current structure while looking to build a new and modern clinic at the same site, because there's sufficient land, and Blue Hills is the biggest it has the biggest population in the country, and I keep on saying it is densely populated. There are about 5 schools. There are hotels going up. There are a number of churches.
It also has an aging population.
It has an aging population. There's so much happening in Blue Hills that we can't shy away from what is happening, you know. So that is currently happening at the moment. So we're looking at temporary means because we don't want to move the clinic features out of the community. So we're just looking now at a temporary proponent so that services will still be offered, but also the construction of a new facility that would be able to cater to a wider range of persons for Blue Hills. And then just to pivot to the polyclinic, which we've been talking about it since last year, but apparently not most persons, a lot of persons weren't paying attention to it. So the purchase of the family care building is not a new purchase, but it's an essential purchase. We heard the cries of persons going into the clinic at the hospital, you know, overpopulated, small, not being able to see doctors in a timely manner, limited service offering. All of those things will be catered to and addressed with the new polyclinic that we would have purchased. Also, the polyclinic will also have features for outpatient services. So minor procedures can now be done. You know, we're looking to enhance our ophthalmology services, enhance our screening services, and just overall, you know, checks. You know, we don't go and get an annual checkup. So all of these are services that were once offered at a bare minimum. We're looking to have a greater capacity of persons being able to tap into these services. And again, when you think about 5 Keys in Q-Town, you think about Long Bay and Leeward, you know, who's to say that clinics wouldn't pop up in these areas as well? But again, it boils down to the financial
Cost.
financials, right? We want all of these things, but government, outside of any additional revenue generating streams, have to make financial decisions that may not be favorable to some, but these are the things that you have to do from a governance standpoint.
Yeah. Let's go back to TAP, Honorable Minister. I can feel my watch ticking away. So there's a lot of concern about individuals now who might be overseas on treatment. What is going to be the mechanism to ensure that those people aren't left midstream?
Well, they have caseworkers. You know, we haven't given any directives to those caseworkers or to the NHIP to stop any services. So from as far as I'm concerned, all of the medical services that are currently being administered are currently in train. Even if there are persons currently waiting to be sent abroad, they'll still be sent abroad. We haven't, tentatively, we were supposed to have everything done by April 1st. But again, that teeters on whether the legislative proponents would be, and amendments would be done. So, you know, it's not ironclad. So I just gave you from a time frame an idea of what we're working with. And then, of course, there's still a grandfathering in, and I think there'll be probably an additional 3 months to allow persons to seek, you know, other alternatives for insurances, what have you. But until then, everything still remains the same.
So you're saying, Honorable Minister, that this amended regulation has not yet taken effect?
It hasn't taken effect as yet.
Do you have an idea when?
Well,
You
that's
said
why,
April 1st?
Yeah, we
Somewhere around there?
We wanted to look at what April 1st would look like, but again, just based on the ability to get the amendments and legislation and all of those things properly prepared, I will definitely make sure that we communicate this effectively to the wider public so they have a greater understanding of the broader plan and what that would look like, so that nobody feels that, you know, it just happened overnight and they'll be left out.
So, Minister Knowles, has your ministry ever considered publishing a TAP expenditure report for transparency so that we can actually see what is spent?
This is, you know, that's a good question, but this is where it goes back for me from a public education standpoint. everything that we've been saying about TAP, we've been saying for the last
Few years.
4 or 5 years since we came into government. Every appropriation, every budget cycle, we've talked about NHIP, we've talked about TAP. So for it to be such a shocker now, it's kind of, you know, it takes me, it takes, it's, you know, it's, but nonetheless, if a report is what it takes just so we sensitize the public, I would definitely see what we can do to have that done, just so that the public is aware
Yeah.
of what we're spending on the service.
I think you may have addressed this already, but what happens, Honorable Minister, in an emergency where a non-eligible person requires life-saving treatment overseas?
So the caveat to that, and it's so funny you said that, because the same people who may say we're inhumane don't understand that we are humane, because there are many cases where we have a humanitarian clause or a humanitarian proponent that allows us to send persons abroad. Now, the issue with that is which country will take them. But these are the things that the general public wouldn't be aware of. So we have to be mindful that, you know, government is sensitive to all of the needs of its people, right? Not everything would be dressed up and put with a red bow on it, you know, and there are many of us who care about the well-being of persons within our country. I mean, I can tell you about stories right now that would probably have everybody in this country crying, right? Where we just had to make a decision in the middle of the night or broad day, where we just had to shut everything down and deal with persons in those particular life-saving positions, because everything is an emergency, or everything could become a priority based on who you're talking to, right? But we have definitely stepped in from a humanitarian standpoint to deal with a lot of these matters. So those things will remain as well. You know, we still are responsible for indigents. We still are responsible for seniors. We still are responsible for what's at the state. All of these persons will still have to be, someone still has to look after them. And that's still a cost to the government, regardless of what we think.
Yeah.
You know? So yes, those positions are still taken at times.
What's your end goal? To reduce TAP by 20%, 30%, 50%, or just any reduction you'd be happy with right now?
I would say any reduction, because any reduction would just prove that what we were trying to achieve was achievable, and that the decision that we made was effective, and it would just definitely put us in a position to strengthen the primary health care service offering.
And Minister, we know in almost every aspect of government, there's always the comment that there's some abuse or corruption of some sort allegedly. Has the ministry strengthened oversight to prevent abuse of TAP going forward?
You know, I want to be careful how I answer that question, because it's always a negative connotation until it's your time. Right?
That's true.
It's always a negative connotation. There's always this fueling argument about corruption or wrongdoing until it's your family member who's in dire need of help, right? And that's why we don't make emotional decisions.
Yeah.
We don't make irrational decisions. We make decisions based on facts. We are enhancing the way we manage processes. We've hired a new CEO for the NHIP. We are making adjustments to strengthen our board. We are making executive changes to strengthen the executive management of the NHIP. And that is to make sure that the level of transparency and accountability that the people have been asking for, they actually receive, right? But this takes time, because we've seen what the past has given us. We can't afford for that to keep going on into the future. And that's the NHIP component. As far as the treatment abroad component, we are building greater capacity within that space as well. So that there's management at the top, so that we can have a greater understanding of how funds are being expended, how services are being managed, what contractual arrangements are being made, how we can manage the service offerings. You know, all of these things speak to the complexity of healthcare.
Yeah.
Some things aren't sexy, You know,
True.
some things aren't attractive, but these are the things that keeps us up at night. You know, my PS is working hard. You know, my DepSec is working hard. You know, the CMO is working hard. Do they get the praise for the work they do? Probably not. But I just want to pause and tell them to say thank you, because we are working to make sure that everyone at every level is provided with the bare minimum primary health care services. Everything else, you know, we will work to see how we can subsidize or strengthen in those different spaces. But you know, we just have to be realistic. We have to be honest. You know, healthcare is not cheap.
Yeah. So Honorable Minister, while I know the answer to this question, for the benefit of our listeners and viewers, I'm sure your ears must ring a lot because your name gets called a lot. Who approves overseas referrals? Is it a medical board, the ministry, cabinet, you?
So the way the process works, and I stand to be corrected on this, and if I do have to follow it up with something in writing, I definitely will. But as it stands, every patient that will be referred abroad must go through the hospital. The doctor who is providing that level of medical care provides a referral. That referral is then passed on to the NHIP, service the caseworker or healthcare coordinator. At that point, and again, these persons are also trained nurses as well. So they understand the reading of charts, they understand the medical lingo, so they are equipped to make medically informed decisions under the guidance of the medical director, right? Based on the referral, the medical director and his team will determine, once putting out what we refer to as a call in the network, to who will take on the case in nature.
Right.
At that point, based on airlift and availability of services, then they agree, or that's where, at that point is where the decision was made. So at no point does the minister, or the permanent secretary, or the premier, or the any other minister step in and say, you know, this person is going to X place. Now, I will say there are times where we are made aware of it, and primarily from the family members, right? The family members are the ones who would really inform us or pull us into the grid and into the scenario, because outside of any of the processes, it stays within the organization. And for us, it's really about knowledge, you know, getting an understanding of where the individuals are going. And if we have to communicate back to the family, you know, we're communicating from a place of trying to sensitize them around not really affordability, access to care and time. That's the reason why we go and we visit these medical facilities. You know, we would have gone to Colombia, we would have gone to Cayman, we would have gone to the US, you know, to look at these medical facilities, because when you call me, you know, and there's this pandemonium around, I don't want to go to this place.
Yeah.
I have to now, from a ministerial standpoint, offer you some kind of reassurance that, listen, yes, you're going to Colombia, you're going to be okay. I've seen the facility, you know, I've walked through the halls, I've seen the operation rooms, we've spoken with the international staff, you know, while everything isn't as robust as we would want it to be, you're in good hands.
Yeah.
Right? So this is the depth that we go to make sure that our citizens are comfortable when they go abroad. We have one or two other stops to make, because, you know, things are changing in the medical landscape. And of course, as things change, we'll bring that information to the wider populace. But we have a mammoth task in the front of us, right? We're not shying away from it. You might not like us now, but you'll love us later. Yeah. That's the only way. I mean, you know, because we're going off of factual off of facts. Data driven.
Yeah.
It's all data driven. We're not sketching on a pad. We're going off of information that is provided to us by the professionals in those fields. So the information that we're privy to, while we would like to disseminate some of it into the public, we have to make those decisions.
Just want to stop a second, Honorable Minister, to say hello to a Turks and Caicos Islander who's living abroad, and especially she's a Grand Turk girl, Georgie Stiles, and she says to tell you good morning and to keep up the good work.
Oh, thank you very much.
So, Honorable Minister, let's get back to the treatment abroad. And I kept saying, and I've been saying all morning, there's so many comments and out there about this, but are there any safeguards to prevent favoritism? Some people say, oh, this one gets sent there because of so-and-so, and this one gets sent there because of the other. Are there any safeguards to prevent favoritism, or does favoritism exist at all?
So with many processes, there are policies. So we're looking at the policy that speaks to the overseas medical treatment, and how that will help to guide us as to how it's being administrated, and for transparency, right? Because then at that point, persons would understand that the minister isn't sitting there with a stack of medical records on his desk determining who will go where and dropping them in a bin, and then disseminating it. That's not the way it works,
right?
Or making calls to relevant individuals with hopes of lobbying for certain outcomes. I had to say to someone a few months ago, family member was ill, time was of the essence, and they were adamant to go to a particular place. I said, listen, while I'm not a medical doctor, the information I have is that time is of the essence. The route that you're going, you may not favor it, but the doctors are really good. Now, when the air ambulance comes, you have a choice to make, because now you're making a decision based on behalf of your family member. I would suggest you do what is right and go jump on that plane and go. 2 days later, they called me back, got in, went straight into surgery, everything worked out, and they were thankful, right? Not because I shied away from the problem, but because I was in a position to give them guidance and to give them some reassurance. Now, whether or not the place they went was, ideal, I don't think that really mattered at that point. It was really about service delivery, and we were able to reassure them. So all of these things happen from time to time, and while we're not always speaking to it in the public, some good stories are happening.
Yeah.
Some good outcomes are really coming about, but we need to get those same good outcomes home.
Yes.
We need to build that local capacity home.
Yeah.
We need to make sure that as our own doctors are being trained, we get them to come back home. And this is where the onus is now not just on government, but the private sector as well, to make space for these individuals when they come back home, because government is not always going to be in a position to hire all of the doctors,
right.
or with the various specialties. So there has to be a closely knitted collaboration in that effort.
Yeah. Honorable Minister, I saw an article that alleged or hinted to the fact that this amendment could cause a lack in investor confidence or skilled labor attraction. How do you respond to that?
I think that is kind of far-fetched. There are a number of companies here locally that already have private insurance. They're attracting the best of the best. Their companies are operating, at high levels. You have some stat bodies in government that already have private insurance that are hiring top caliber individuals. I think, if you're looking for brownie points, that's not one way to go. You have to think, we have to be practical. If you're bringing in workers to the country, why are you bringing sick people? Because they're going to put a strain on your company or your organization, because one, they won't be able to show up to work every day. But further to that, they're going to put a greater strain on the government, because now after their eligibility to receive care, they'll spend so much time receiving treatment that that there's no benefit
Yeah.
to
No
us as a
productivity.
country, nor to your or to your company.
Yeah.
Right? Now, if that person were to have if their own medical coverage, then if they come or they go, then let the chips fall where they may, but it wouldn't be a strain on the government. Because guess what? When you think about that strain to the government, that's money is being expended on care that could have gone elsewhere.
Yes.
You know?
Yeah.
So in a very practical sense, we have to get out of this mindset of mischief making or trying to prove a good point. Because sometimes you could prove a good point, but it still takes you nowhere because you can't really justify that good point, right? So we have to be mindful of that because I realize a lot of people make a lot of good points, but when you ask them to put it into practice or to execute, you can't.
Yeah. Yeah. So, Minister, beyond the controversy, what assurances can you give the people of the Turks and Caicos Islands, both citizens and long-term residents, that this reform strengthens our healthcare system rather than divide our community?
It strengthens our healthcare system because it allows us, or it puts us in a better position to talk more from a very, from a tangible place around primary healthcare. About preventative care, about building local capacity, strengthening local capacity, working with the private healthcare providers. And I've been saying private healthcare providers, and I know many of them might probably be there shaking their heads, but I have to say that because I know that there have been a significant lapse in communication between government and the private sector. That's why we're having the meeting, probably a first of its kind. You know, and then they'll also be having their own elections for the medical association. So we're looking for, in totality, a shift in everything medically inclined. There's no need for the division, right? If we really care about the Turks and Caicos Islands, like we say we do, everybody has a part to play, right? We can't just be singing out of the same song, out of the same hymn book when it's just good. You know, sometimes we need to hold hands when things get tough.
Sing kumbaya.
And sing kumbaya, right? But those difficult times won't last. You know, they're only but for a moment. Because when the government now can make the adjustments to the way we spend and the way we collect revenue, and we're able to expend those things, probably not monetarily all the time, but expend whatever that may be into the wider community offering, it benefits everyone.
Yeah.
You know, I'm sure if we were to save a significant amount of money with the 60, and going back in reference to the 62 million on roads, I'm sure the Blue Hills and Wheeling people will be overjoyed.
Yeah.
I'm sure if we can take that money and put it into the housing development, a number of young Turks and Caicos Islanders would be overjoyed. If we were to take that and put that into scholarships, we can do more.
Yeah.
You know, we'll educate our populace, you know, at a greater level. We can take that money and put it into the community college, into the vocational aspect of things. You know, so we have a wide range of different competing priorities that garner financial support. Healthcare, we are just doing what we can to manage healthcare in the very complex way that is being administrated.
Yeah. Minister, we spend a lot of time on the treatment abroad program as was designed so that we could clear the air and get some clarity on that. But I would absolutely not be forgiven if I didn't mention that I got a call this morning saying there's a huge feral dog problem in Grand Turk. And what are you going to do about it?
Well, the feral dog problem is actually not my problem, right?
That's what I said to them. I didn't think it is.
And I shouldn't say not my problem. I retract that statement. I will reach out to the Environmental Health Department, but we will also reach out to the Agriculture Department, who has responsibility through their veterinary services to address this from a public standpoint. Because it's not just a Grand Turk problem, it's a Provo problem. And I'm sure Honorable Jolly's phone is ringing off because I send him a lot of messages and pictures as well because it's just out of hand, you
Yeah.
know. And then two, there's a lot of neglect from a ownership of these animals as well. Because someone will just put a collar on their dog and just let the dog roam. You know, by law, if you have a dog, your
Should be
dog should be
leashed.
chained to your yard. If not, your yard should be fenced. And then two, if your dog is caught, I think there's a 24 to 48-hour period of of uh,
Wait.
of wait time before your dog is identified, before the dog is put down. So all of these things are now picking up traction. So I honestly, I'm of the view that in the new financial year, he'll be getting a bit more monies for trapping of these animals.
Yeah. What about the waste management? How is that project going?
So the waste management project is moving. There's always need for money again. We have the incinerator on island now in Providencia Islands, which is good. We've been waiting for that for about 2 years. The solid waste consultation work that encompasses the entire Turks and Caicos is scheduled to close at the end of March. You know, finally, the recycling initiative in Grand Turk is somewhat delayed due to the some proponents with the government, right? But from a solid waste standpoint, things have been moving. I must say that there's always room for improvement, but we aren't in the same position we were in 3 to 4 years ago. So that in itself speaks to the government putting our money where our mouth is, providing the resources, getting things done, listening to the general public, and trying to enhance in that perspective. But I will say we have to do a better job as citizens because there's too much garbage being thrown in the street.
Yeah,
Persons
absolutely.
are just nonchalant about the way they keep, their yards. People, there seems to be no pride. There just seems to be, the government. And then when the operators now have to go out because everyone is given a route, when they now have to go and have to extend their service into other areas, they write into the government because now they have to take on another charge because this wasn't in their scope. And all of these things cost money.
Yeah.
So while it's not always about the money, there's a lot to do with social responsibility, a lot to do with as individuals, us taking the initiative and doing certain things. And yes, I realize we're all busy. But, sometimes I'm even dragged over the coal. You have to stop and pay attention.
Yeah. And Honorable Minister, just quickly before you go, we know it was announced that NHIP was having a consultancy review. How's that going?
So that's going well. It has allowed us to identify a number of those gap areas. Hence the reason I alluded to the fact that we are onboarding a new CEO. So that should happen within the next few months. You'll see, some internal shifts to the organization, strengthening the compliance, looking at how we improve registration, making sure that persons are registering and actually contributing the way they should, making sure that these services are actually carried out in the islands. There's been neglect over the years for South Caicos, North Caicos, and Middle Caicos in presence of NHIP. So we want to see how we can strengthen those services in those islands as well because they're contributors.
Yeah.
They come to Provo, they have to bear a little bit more costs. But even with that, if we can mitigate that and take those services to them, we can make sure that whatever their needs are being addressed at home.
Yeah.
So,
and Minister, final comments. How are you going to ensure that healthcare remains compassionate but financially sustainable?
I was going to make a cheeky remark, but the good thing about healthcare in the Turks and Caicos is that, and this is not a knock on any of my predecessors, you have a minister and you have an executive team that cares, right? We care about the well-being of our citizens. We care about the way things are being administered, but we also have a financial responsibility to make sure that we do things, with transparency, so that persons aren't disenfranchised when those times come about. We do understand that there's a lot of work to be done, and there's a lot that as individuals we need to do ourselves, with the cutbacks on, certain food items, being a bit more active, and all those personal endeavors that would cause us to get to that state of becoming ill and taking on some of these non-communicable diseases that have just plagued us throughout time. We have to, we understand, right? And it's not easy. There's some things that there was a bit more that I wish that I could say, but again, the nature of the job, the complexity of it, and adhering to, privacy and confidentiality, that doesn't take away from the fact that we are doing what we can to take care of our elderly, to take care of our children, to take care of those persons who can't take care of themselves. But it's important for, our partners or stakeholders to meet us halfway, right? Because it from a very cliche place, it takes a village, right? It takes a village, and understanding that we are a small village in comparison to our partners or our colleagues around the region, it's almost intimate. It almost feels intimate in the way that we deal with a lot of these cases. So we understand, we want to do, or we're going to do, what is in the best interest of our people.
Yeah. So, Honorable Knowles, we want to thank you so very much for taking the time out this morning. We're going to review the comments. Who knows, you might be back here Tuesday.
Wow.
Depending on what the comments say and if there's any further clarity needed. But we want to say thank you to you, to your ministry, to the entire health team for the job that you do each day. And like you said, we know most of it is not easy decisions, but they're in the best interest of Turks and Caicos Islanders and Turks and Caicos Islands. And so we thank you, sir, and we wish you well.
Thank you. Thank you very much.
This has been First Edition. We'll see you next week.